Hello, good evening.
Hi, good evening, Professor.
Okay, so seems like we have some people already joined the class. We still have a couple of minutes remaining. So as soon as we hit 5:01, we're gonna start with the class. Do you guys have any questions up to now? Okay, so that means no, which it might be good. Okay. Okay, so let's start the class. Good evening again for those who just joined the class. We're going to continue with the skeletal system once again. The skeletal system has to do with bones and cartilage. Remember, these are the two major components, parts of the skeletal system. So things that you really need to remember about this chapter is, remember how many bones a human adult person has. 206. You need to remember also what are the names of the cells that makes up bone. Osteocytes. What is the name of the cells that makes up cartilage? Chondrocytes. Where does blood formation, red blood cells, white blood cells are produced, or where blood formation takes place? The epiphysis of the large bones. Remember, that is important. What is the name of this process of blood or cell blood formation? Hematopoiesis. You have to have it, you have to know it, because these are very common questions for national exam. I will ask on my final exam because I want you to keep it in mind, to have it right there and to use it when you need it. So that's basically the most important part of this chapter. There are some few questions about certain bonds that you might be asked. When we get there, I'm gonna let you know. Okay, so let's move on. Let's go to the slide that we were covering. We were starting with the spinal column, the bones that makes up the spinal column. So let's move there. Oh, one more thing. Remember the mandible. The mandible of the lower jaw or the jawbone. Remember that is the only bone movable of the body. I mean, I'm talking about the face bones. So be careful with that question and answer from the face or the facial bones, the mandible, the lower jaw is the one that moves. It's the only movable bone of the facial bones. Very important. This is the one, the mandible. Remember, you must know these, the jawbone, the mandible, the low maxilla. It's the same thing, but they use the mandible or the jawbone. So be careful, facial bones. Let's start with the vertebral column. So this is also called the vertebral column, the bones of the vertebral structure. So that is it. So it's not something that is going to be difficult because it's going to be talking about the vertebrates, those single bones that makes up the vertebral column. Okay, so be careful with that. So it says it forms the vertical axis of the skeleton. We talk about this being part of the axial. Remember, the axis, axial is the same, the center. Here, other bones, other structures are going to be attached to it. This is like the center of, this is like the tree, the trunk, the base of these three is going to be the vertebral column. So that's basically what it is. It says right there that consists of many vertebrates. And each vertebrate is going to be separated by cartilage. So that's basically what it is. We have ligaments, we have muscles attached to it. That's irrelevant right now, but knowing that the spinal column or the vertebral column is a bony structure. Individual bones forms this structure, and they are separated by cartilage. What is the function of these bony parts? Remember, the vertebral column are bones, vertebrae, they are irregular in shape. They are very difficult to define. So these are the most common irregular bones of our body. It supports the head and the trunk. Remember, the bones on top of the vertebral column, they are the ones that are attached to the cranium. So they hold the head in place so it doesn't fall to the sides. So that's basically what it is. And it has movement. The spine is not fused together. Not all of the bones of the spine are fused. They have very slight movement because that's the reason that you can bend forward to the sides, to the back. That's why you can move the head, you can rotate the head, you can move it forward, to the back, to the sides. The same with your waist. You're going to be kind of moving around, but it's very slight movement because the bones are kind of very tight together. They have a little space, but the space is the cartilage that allows these bones to move a little bit. Of course, one of the major functions of the bones is protection. So it protects the spinal cord. This cord then allows all these main nerves to pass through. and to send other branches from this main cord to the rest of the body. So when the person is a newborn or a person who is a minor, usually have 33 separate bones or vertebrates. Remember, before adulthood, we have 33 vertebrates. Now, as we age, in all the growing factors and all this growing has ended, now some of the bones are going to fuse together. There used to be 5, now we have 1 because they fuse. So that is the difference. Then we're going to have other bonds fusing together. There used to be 4, now they are only 1. That's why we end up with 26 separate vertebrates within our spinal column or the vertebral column. That's how it is. So if you've been asked a question, how many vertebrates does the human body has? They have to specify whether it is an adult or it is a child, an infant. Because otherwise, if you have both answers right there, you don't know which one to pick. So they have to be very specific. They're going to tell you, as an adult, how many vertebrates the spinal column will have. So you said 26. But if it is an infant, then you're going to say 33. That's supposed to be your answer. That's how this works. Later on, in this chapter, we're going to see which are those vertebrates, the fuse that becomes 1 when they used to be 5 or 4. So that's basically what I want you to understand. Anything else is like, very general, but for questions that you may have in your exam, this will be something that you have to pay attention to it. Let's look at the spine column. So if you see here, there are 2 images. This is an anterior view, and this is a lateral view of the spine. If we look at the anterior view of the spine, it looks straight. See, it looks straight, but it's not. It's just because we're looking at the person directly when they are standing. Remember, erect. Remember the parts of the anatomical position. Standing erect, looking forward with the feet a little bit separated. So then we're going to see the person from the back, and the spine should look straight. If it doesn't look straight, this person has some of the conditions of abnormal formation of the spine, like scoliosis, for instance. So that's how it is. If we look at the spine on the side, it has these curvatures. See, it has these curvatures. This is normal. This is how the spine should look like on a lateral image. We're gonna name these parts, so to speak, or regions of the spine. First, we're gonna have these 7 vertebrates. These are the cervical vertebrates. So here we have the cervical curvature, which is this one. This is the cervical curvature, where this is where the neck is at. It has 7 vertebrates. They call cervical. So therefore, we start with the letter C for cervical. C1, C2, C3, C4, C5, and C6, and C7. Seven cervical vertebrates. So here we have 7. Then we have the next section, the thoracic curvature. Thoracic and the thoracic curvature in the 2 different views. Thoracic. I'm going to tell you a key that you can use. Thoracic starts with the T. So this is T for 12. 12 thoracic vertebrates. T12. T for thoracic, T for 12. Because I don't know how to spell out anything. I'm very, very bad spelling words. So I'm going to use cervical 7. Cervical, I'm going to use S. Cervical, I just misspelled this. Cervical. Cervical 7. That's how I remember everything. Do you think that I'm smart? Not at all. You have to look for keywords, something that can later on help you to remember things. So I remember cervical 7. Oh yeah, I got it. Thoracic 12. Now the next ones, sorry, you need to know it. But at least I have half of these regions that have some cues right there that helps me to remember this amount of number of vertebrates for each region. Remember, cervical 7, thoracic 12. Now we have the lumbar region, lumbar. And here we have the lumbar curvature. This is the lumbar curvature. So the lumbar has 5 vertebrates. Unfortunately, there's nothing that relates to lumbar that is going to help me to use the first letter of lumbar to associate it with the number of vertebrates. So you just have to remember this. 5. L for lumbar, T for thoracic. Remember, 12 thoracic vertebrates, 5 lumbar vertebrates. L1, L2, L3, L4, and L5. Now, we are going to find the sacral or sacrum curvature. So it will be this one, the sacrum. These have 5 vertebrates. But these have 5 vertebrates when you are an infant. So in adults, this becomes 1. So the sacral or the sacrum vertebrates or curvature, they have 5 when you were an infant. After that, they fuse. If you look in this image, you can see right here, these bones fuse together. There is no cartilage in between. All these vertebrates has cartilage in between. See? They have cartilage in between. They have cartilage in between. They have cartilage in between, meaning they have some type of flexibility. But if you look at these ones right here, they are completely fused together. See? They are fused. They have no movement because they just stick together. The cartilage disappear in adulthood. So before When you were an infant, you have 5 little bones right here. 1, 2, 3, 4, and 5. So therefore now they become 1. Then we have the last piece, which is the coccyx. This is the tailbone. See the coccyx? When you were an infant, you have 4 tiny little bones right there. But when you become an adult, they fuse an adult. See, this is the tailbone and becomes 1. Before there were 4. That's why if you add 7 and 12, 19, 5, 24, 29, and 4, 33. But now that they fuse together, they are 7, 19, 5. So that will be 24, 25, and 26. It is not easy to grasp this information right away. You have to review this material, kind of getting used to, getting familiar. I didn't learn this overnight just because the teacher was explaining me this. It doesn't mean that I learned it immediately. No, it took me some time to realize that I have the hang of this just because I was using it a lot. But if I wasn't not, if what I didn't have the chance to use this, I didn't have the chance to apply this to medicine, well, then I wouldn't be able to remember all this. And since I started teaching it, well, kind of, you know, have to go review. And now I have them again, but I did have the basics. So I knew some of the stuff is just the certain stuff I have forgotten. I brought it back. So this is how it works. So let's see how this is going to play out with you. So you're going to be able to remember some of the stuff, some other you don't. So remember the cervical part, which is the neck. Here we have. So I have these lectures broken down. The vertebral column consists of 7 cervical vertebrae, which is this one right here. Remember, 7. This is the neck. 12 thoracic, remember 12, T, thoracic, 12. T, thoracic, T for 12. 7, cervical. Remember, become a bad speller. So spell cervical with S. And then you will have the answer. 5 lumbar vertebrae. These are the thoracic. 12. Once again, these are the lumbar. 5. And the huge sacral bones, which is this little part right here. And then the coccyx, which is this tailbone at the end, this little piece that sticks out. And this will be the sacral. That's basically what it is. It says right here, the 4th fused coccygeal vertebrae, or the coccyx, which fuses between the ages of 25 and 30 years old. Thus, the tailbone fixes later on in life, in adulthood. The sacrum, it fixes during infancy. After the patient has reached 1 year, maximum 2 years, this sacrum fuses together. Remember, the tailbone is the coccyx. That's basically what you need to remember. So if you have a question, it will be based on deformities of the spinal column, like scoliosis, kyphosis, which are the most common. Moving on, let's talk about this cervical vertebrae. Why is it that the cervical vertebrae is so important? Well, because these are the first cervical vertebrates, and they have a very basic fundamental function. So the first vertebrae of the cervical vertebrates is called the atlas, C1. This is the one that enters. This is the atlas. This is the one right here that enters inside the foramen magnum, or this bony structure, this hole that we have in the base of our brains. Remember? So picture right here. Here it is. Here, this atlas is gonna go inside. So it's gonna keep the head in place. And it's the one that is going to give a little kind of stability to the head. So the atlas is the first one that enters this hole, so to speak, this opening that is called the foramen magnum. Nobody's going to ask you that, but the atlas, yes, they're going to ask you, okay, what's the first vertebrae of the spinal column? So then immediately it says, oh, the atlas. And you're going to remember that because it starts with the A. A is the first letter of the alphabet. A, atlas. Oh, yeah, got it. Once again, I use a bunch of cues. People call it mnemonics. Well, you can call it whatever you want. But that's how I remember most of the things. Once again, I'm not that smart. I have too many things in my brain stored right there. So you can't just see something, being asked about something, and you know the answer. No, probably you went over this long time ago. But if you're not using it, it goes to the storage room.
Professor, I asked you a question in the comments. Can you read that, please?
Say it again.
I asked you a question in the comments. Can you look at it, please?
Oh, sure. Remember, I don't have direct access to that because I have my PowerPoint presentation going on right there. Okay. Um, I don't. Do you use the chat? Oh yeah, Professor. Correct. The only bones that fuses in the spinal column is going to be the sacral bones and the coccyx. They are. Yes. Is
Okay,
that
thank you.
just to confirm? Because you have the answer.
Yeah,
That was
yeah.
just to confirm. But remember, um, you have your notes because everything that I'm teaching right here, you have it. And just look at it whenever you feel like you forgot about something. But yes, you can ask me. And don't feel afraid to ask me that right directly. Said, Professor, I have a question. You're not interrupting me if that's what you think. No, because I'm not having in front of me the chat. I have in front of me the PowerPoint presentation that I'm covering. And in order for
No,
me to
yeah,
see, go ahead.
I'm not home yet. I'm in the bus. That's why I wrote it.
Oh, okay. No, no, no. Sounds good. No, I understand. And I appreciate that because at least, hey, wherever you are, that's the beauty of technology, right? That's fine. No problem. All right, moving on. So the atlas is the first vertebrate of the spinal column, and it belongs to the cervical, because the cervical are the first one, the neck vertebrates. So it supports the head. Remember, that's its major function. The second, now here is another one. The second is the axis. Now you're going to say, Professor, you said that the first one starts with an A and the second also starts with an A. Not a problem. You are following the alphabetical order. A, T. T goes before X. So applies. A, T for Atlas, the first one. If I have axis, that will be AX. Oh, X is ahead, is in front of T. So guess what? This is the vertebrae number 2, C2. So what is the function of S2 or the axis? This is the one that provides flexibility, movement to the head. So I can move my head, I can rotate my head, I can lean forward my head, back and to the sides. So that will be the axis. The atlas just hold the head because it's the one that enters this opening of the base of the cranium, which is called once again the foramen magnum. They will not ask you about the foramen magnum, but if you have questions, it will be about atlas and the axis and which functions they provide to our body, to our structures. Remember, the atlas just supports the head. It's the first vertebrae of the spinal column. And the axis is the second one. But the importance about the second one is that this is the one that provides movement to the head. So you can rotate the head, you can move the head forward, backwards, and to the sides. So that's basically what it is. Now you see here in this picture, I'm going to make it a little larger, than the regions of the spine, they are colored. So yellow will be the cervical. Well, you can color any color anyways. That does not imply this is not a color code. It's just done just for you to know that that's how we separate these curvatures or regions. So that's basically what it's, all of them are separated by colors. Now we're not going to go over the names of each structure of a vertebrae. See, the vertebrae has all these protuberances, all these kind of lumping structures. So that's what we call it irregular. Look at this. This is irregular. I cannot give a name. Oh, this is a round shape. This is a star shape. This is a triangular shape. No, it doesn't. So for that reason, we call it irregular, period. So if you have a question when they ask you which of the following bones will be considered irregular, the first thing that you have to think is look for the vertebrates. They are the most common irregular bones of our body. So that's how I want you to think about it. Remember, I'm giving you hints of things so you don't have to memorize everything because that's not the purpose, particularly for the exam. So most of these questions I will be giving to you on the final exam so you can keep them present. You can review them. Let's talk about now, let's move away from the spinal cord. We talk about the cranium. Remember, we're talking about the actual skeleton that has 80 bones. We talk about all the cranial bones, the spinal cord bones. Now we're going to talk about the spinal column bones or vertebrates. Now we're going to talk about those bones that attach to the spinal column, which are the ribs that we call it the thoracic cage. So that's basically what it is. So we're going to see all these ribs plus another bone that holds these ribs right there in front of our chest. So we're going to see them. We know already what is the function. Remember, one of the major functions of the bones is to protect internal organs. The chest bones, the rib cage, the thoracic cage, all of these names are used interchangeably. They means the same. So once again, underneath the chest bones, we have the lungs, the heart, and major blood vessels. So we're going to protect them. Also, this chest cavity that is formed by this thoracic cage assists during breathing. Think about this. When we breathe, our chest expands and recoils. So you don't see it sometimes, you don't notice it sometimes, because we just breathe automatically. We don't have to think that we're going to breathe. So we get used to, so we don't pay attention to that. Oh, but yes, run. Do some strenuous exercise. And then you will see that your chest expands more because you need more air to enter the lungs. So if you breathe deeply, let's say that you take air deeply, you do this, you feel like your chest expands. Then you release that air, your chest recoils, meaning goes back to the normal size. But that is needed. Even though if I'm sitting right here, my chest is expanding and recoiling all the time. All the time. Because that's why respirations are for. You have to breathe. And when you're checking the patient's breathing, that's what you're gonna do. To check the patient's chest when it expands, that's it. And you count that per minute. So that's how you're gonna tell the patient how many respirations per minute they are taking. So when we get to that clinical procedures, you're gonna learn how to do vital signs, how to do blood pressure, how to do respirations, how to count them, how to do the pulse, and some other vital and measurements that are very important. So in this case, the thoracic cage assists during respiration. So if you have a broken rib, you're gonna have problems breathing because it's gonna hurt when the chest expands. If you've been coughing a lot, now you're gonna get these muscles surrounding the ribs that is gonna be sore. So when you cough, you feel the pain in your chest. And that is the same as when you breathe profusely. We all have probably gone through this. We got some kind of flu, some viral infection that affects our upper respiratory system. And when we try to breathe, it hurts. So we don't want to breathe because of that. Or we're going to breathe very, very mildly. That's because the rib cage is attached to these muscles on the chest and it needs to expand because the lungs are filling in with air, so it needs some space. And then when we breathe, goes back to normal size and the rib cage recalls back to its original shape. So you see, it's a lot. You see, it's not just talking about the bones, it's the functions that they have. And how do we use all these in medicine to diagnose our patients? To tell them whether they're having the flu, whether they're having some soreness on the muscles because they were doing exercises or lifting some heavy stuff versus they have a heart attack. See, it's important. Okay, so the thoracic cage. Let's move on and kind of define a group of ribs. We're gonna break down the ribs just like we did with the spinal vertebrae. We're gonna separate them in sections, groups. And of course, each section, each group is gonna have a name. So looking at this picture right here, I just can tell you that we have 12 pairs of ribs, 12 pairs. That means we have 24 ribs. Be careful, this is a question for exam. How many pair of ribs do we have or do humans have? So then immediately you go and read and it says, oh, 24, because we have 24. No, we don't have 24 pairs because then will be 48 ribs. They're going to put 12 pairs, 20 pairs, 24 pairs, and then it says, oh, 20, 24 because 24 ribs. No, there are pairs. 12 on the right, see? 12 on the right and 12 on the left. Total 24 ribs. But we are going to separate them by groups, and we're going to call it names. We're going to have something that is called true ribs. And we're going to have another one that is called false ribs. Oh, what do you mean true ribs? False ribs. That sounds like fun, right? Well, it has an explanation. So let's look at this image that I have right here a little larger. So I'm going to enlarge this image. So then I can tell you what's going on right here. I'm going to enlarge it. I'm going to enlarge this. Oops. And go. Oh my goodness, what the heck is this? Oh, now it is. So these are the ribs. So the ribs on the back are attached to the spinal vertebrae, to the spinal column. In the front, they are attached to this bone that is called sternum. The sternum. This is the chest bone, sternum. That begins right here. This is the sternum. If you kind of feel your chest right here in the center, chest area, this bone is called the sternum. Here is where the ribs attaches right here to the sternum. Now, look at what I'm doing. So some of these ribs will attach directly to this bone. And these are rib 1, 2, 3, 4, 5, 6, and 7. Oh, wait a minute. 7 ribs. These are the true ribs. What do we call it the true ribs? Because they are attached to the back, to the spinal column, or to the spinal vertebrae, and in the front, they are attached to the sternum. So they are kind of fixed there. That's what it's called the true ribs. It says right here, true ribs, because they are attached to this bone. Now we have false ribs. Okay, wait a minute. What do they call false? Because they, again, all the ribs are attached to the back of the spinal vertebrae or the spinal column. But these ones are not attached, the false ones are not attached to the breastbone. They are attached to the 7 rib right here. See, this is the 7 rib, and all of them are attached to each one of the consecutive ribs that we have following this one. So this will be, so we have 7, and then we have 1, 2, and 3. So the 3 pairs of false ribs. So we have 7 true ribs. 8, it is false. 9, it is false. 10, it is a false rib. Why do we call it false? Because they are not attached directly to the breastbone, to the sternum. They are attached to the 7 rib and consecutively to the 8, to the 9. So that's how it works. Then we have the floating ribs. What do they call the floating ribs? Because they float. They are only attached to the back. Here we have number 10, number 11, number 11 and number 12. They are only attached to the back, so they are floating there. So nothing that holds them in the front. That's what's called the floating ribs. So we have true because they are attached to the back, to the spinal column, to the front, to the chest bone or sternum. False because they are attached only to the back, to the front, to the cartilage of the 7 ribs, the 8 ribs consecutively. Floating ribs, there are 2 pairs. Which ones are those? Number 11 and number 12. They are only attached to the back of the spinal column, spinal vertebrae. See now, why do they receive these names? And it's easy to remember because true, false, and floating. Oh, they are floating right there, only attached to the back of the spinal column. True. Oh, they are attached to both the spinal column and the sternum, the breastbone. So false, they just attach to the back. In the front, they are attached to the cartilage of the 7 rib. So they are not directly attached to the sternum. So that is the key. They are not attached to the sternum, except for the true ones. That's how I want you to remember them. Because otherwise, it's not going to be easy. But just try to memorize, not helping. Doesn't help much. For how long can you memorize? Remember, memorization lasts very, very short period of time. But we don't want things to last just a short period of time. We want something to last. And for that reason, we need to find some ways to understand it. That's basically what it is. So 7 pairs true ribs, 3 pairs false ribs, the floating ribs, 2 pairs. So you need to know that if there is 7 pairs, then, and you have 2 floating, there are 3. 5 plus 7 is 12 because you have 12 pairs. So that's how you are going to remember this. And it is important that you know these are questions for exams. They might ask you which ones are the true ribs. Oh, 7, the first 7 pairs. What are the false ribs? How many pairs of false ribs? 3. What about the floating ribs? 2. So that's how I want you to remember this. Let's talk about this breastbone, chest bone. So it has 3 parts. This is the sternum or breastbone. Chest bone, breastbone, sternum means the same. So it has 3 parts. This first part is called the manubrium. Here it is, the upper part, the manubrium. This is the manubrium, this part right here. It's like, let's put it this way, it's like the head of the sternum. Then we have the body, the middle part. Right here, let's change the colors. So this is the manubrium. This is the body, this is the shaft, this is the longest part of this bone. And right underneath, we're gonna have a little structure right there. Color blue, right here. It's a little tail. This is called the xiphoid process, which is the lower part. So once again, all these ribs are attached to it, but to the manubrium, to the body of the sternum, not to the xiphoid form. This little xiphoid is like the tailbone in our spinal column. It is floating right there. So we have to be very careful when we do CPR. See, when we do CPR, we have to put our hands right here on the body of the sternum. Because if you put the hands right here, you can break this little bone. Oh, the patient is gonna die? No, but it's gonna be painful. And unfortunately, this bone, we have to leave it as it is. We're not gonna do surgical procedure to go fix it again. No, if you break a rib, if you break the xiphoid bone, they stay like that. You have to have some type of rest. They put some type of bandages around your chest until it fuses. That's it. Not much we can do. But because this takes long time to heal, well, we want to avoid it, right? So that's why when you learn how to do CPR, they teach you the proper techniques. So you are not causing more damage to the patient. Try to fix something, not to damage something else. So that will be the sternum or breastbone. Remember, 3 parts, the manubrium, the body, and the xiphoid process. If you've been asked a question during exams, they will ask you, what is the name of, well, the sternum is also known as, then you said, oh, breastbone. Or the breastbone is known as the sternum. That's it. If you have any questions, or where do you place your hands when you're doing CPR? Oh, over the sternum, not just the chest, is over the sternum. That's what I've been giving you explanations about how to do CPR. Any questions? Okay, moving on. Let's talk about the shoulder. The bones that makes up the shoulder are called the pectoral girdle. Now, forget about this name. They're not gonna ask you this. They're gonna ask you, okay, which ones are the shoulder bones? That's it. So we have two major sets of bones. Sets means two or more. So we have the clavicles. We have two clavicles, and we have two scapula or shoulder blades. The collarbone. See, know the second name. Know the terms that we use most commonly. Oh, the collarbone. These are the clavicles. Which are these bones right here? These bones that we have right underneath our neck, our chin, right here. These are the clavicles, one on the right, one on the left. On the scapula, we don't pronounce the E, we said just scapula. These are the shoulder blades. These flat bones right here on the back. We have two, one on the right, one on the left. So these are the shoulder bones. So know the name that most commonly used. We don't say clavicles, we usually say the collarbone. We don't say scapula, these are medical terms. Sir, Mr. Smith, your collarbones are broken. Your shoulder blades are broken. We don't say your clavicles, not with our patients, because they're not going to understand this medical terminology. Remember, every single time that you talk to your patients, you use layman terms, very common terms that the patient can understand. We don't use medical terminology with them. So these structures, the shoulders, are the base. These are the foundation for the upper limbs or the arms, right arm and left arm, because they are attached to them. So if you have problems with your shoulder blades, then you're going to have problems with your arms because they are attached, right? They are to these bones. So that will be the shoulder bones. Remember the pectoral girdle, they're not going to ask you that. These terms usually are kind of obsolete. We don't use it much. Well, I never use them during my practice, so I can tell you that much. It's the shoulders that are important. Let's talk about these upper limbs then. These arms and hands that are attached to these shoulder bones. So we are not going to go and start explaining every single detail. You just know that they use upper or lower limbs, upper or lower extremities. So you know already, you have to get familiar with this. So when you see it on your exam, you know that they are referring to upper limbs, upper extremities, or arms, lower legs. You gotta get familiar with these terms because that's what we're gonna be using all the time in the medical field. So let's talk about these upper arm and forearm and hand bones. So this is the upper arm bone. It is called the humerus. It is a long bone, as you can see. It is a long bone, the humerus. Right below that, we have the lower arm, which is the radius and the ulna. Now, how do we know which one is the radius? Because it is connected with the thumb side. See, the thumb. And how do you know that is the ulna? Because there is the other end. It is connected with the pinky, with the little finger. Now, it's very important because the radius, right where the hand begins, which is the wrist, that's when we check the radial pulse. Because the radial bone protects, or underneath the radial bone is the radial artery. And that's when we check radial pulse in adults. Very important for us in medicine, of course, for you as a medical assistant, because you're going to be checking this part right here by the thumb side. You're going to be checking pulse. We will go over that when we get to that point. But first, we are covering all these structures of the bones. But I like to mention all the things that we're going to be encountered, because as we repeat them over and over and over in every single chapter, I want to make emphasis of the things that are very important to you as a medical assistant. So I'm going to be repeating it until you get this. So once again, the humerus, these are the radius and the ulna. Oh, I'm sorry. This is the ulna because it's pointing to this, and this is the radius because it's pointing to this, because it's using both of the images. But you know that the radius is the one that is lining up with the thumb, and the ulna is the one that is lining up with the pinky. That's it. Those are the major references. Why? Because when you are being asked a question, they're going to ask you, what is the radius located? What is the radius bone located? And then you said, you look for, oh, wait a minute, by the thumb side. What is the ulna located? Oh, wait a minute, by the pinky side, by the little finger. How else can you explain it? You cannot look at your hand and say it's on the right, on the left. It doesn't work that way, because all depends how you have your hand positioned. Or which hand are you talking about? But if I set alongside the thumb, good. There is only one thumb in my hand. Alongside the pinky, I know exactly where it is. Any questions about these three long bones? Now we're going to talk about these small bones. These are short bones, the hand bones. So we have the carpals. So the carpals are the wrist bones. So it will be these bones right here. Then we have the metacarpals, middle, the palm of the hand. So that will be these ones right here. And then we have the phalanges, which are the finger bones. All these right here. So don't forget, because the wrist is made of the carpals. The palm of your hand is made of the metacarpals, and the phalanges are the fingers. Very common question asks, the phalanges. So when you see phalanges, immediately think about fingers. Fingers, toes, no difference. So the fingers and the toes, because we're going to go over the lower extremities, and we're going to be talking about the toes. Well, we're going to talk about same thing, phalanges. phalanges. Just in general, for you to know. So we have covered the bones of the upper extremities. And of course, whatever happens in one arm and hand, we're going to happen on the other one. Remember that this part right here, where the humerus and the tibia and the ulna meets, is called the elbow. This is the elbow. This is a joint where the ulna and the wrist meets. There's another joint where all these other structures meets, little structure right here, there are a bunch of cartilage in between. So they have joints. That's what we call it the phalanges, because they're tiny bones, short bones that are attached to each other through cartilage. And that's why we have movement of the hand. That's why we can close the hand, use the fingers individually. Any questions about the upper extremities or limbs or arms and hands bones? Remember, you don't have to know it all, but if they ask you which is the longest bone of the upper extremities, the humerus. The humerus. What is the name of the bone of the upper extremities called? The humerus. Remember, the radius bone is important because we use it as a landmark to check pulse. We don't check the pulse from the radial bone or radius bone. We do it from the artery that receives the same name because it just goes alongside the radius bone. And that's what we call it, the radial pulse. And remember, the bones of the fingers of the toes are called phalanges. What happened to my low upper extremities? No, the lower extremities. Oh. Oh, never mind. Before we get there, we talk about the hip bones. That's what it is. I was like, wait a minute, supposed to be telling me this. Here we have the pelvic girdle, but we don't call it like that. We just call the pelvic bones. Remember, these terms, we don't use it much. So the pelvic bones are attached. They are supported by the sacrum and the coccyx. So the pelvic bones are not. These are bones of the spinal cord. The spinal cord, I'm sorry. These are bones of the spinal cord. But we use these bones to support these other bones, which are the hip bones. That's basically what it is. And what is the major function of these bones? To protect internal organs. Which organs are we protecting? Think about the hip bones, the hip, the groin area, urinary structures, reproductive structures are going to be protected by these bones. And here is when we are going to be attaching the legs or the leg bones. So it provides attachment for the lower extremities. Protects internal organs. Remember, viscera. supports the trunk. Yes, because here is where the trunk lays out. So those are the important things about the pelvis. Now we're going to mention the bones that the pelvis is made of. So moving on, just know that the major function of the bones is to protect internal organs. Very important. Supports the body, supports all these muscles, skin, organs that we have within these structures. So the hip bones. Forget about all these names, also called coxal bones. Forget about this. Never we're going to be asked. There are three bones that are made up the hips. We have the ilium, which is this part right here. All of these are flat bones. The ilium. We have the ischium, which have an L shape. That will be this one. Instead of L, it looks more like a J. But that's what they said. And then we have the pubis bone, the pubic area, remember that, which is this one right here. Or this one right here. So this part and this part connects to each other, just like in the picture before. See? This L shape right here, the pubic. And here in the center, we have cartilage that is called the pubis symphysis. Now, these structures where the head of the femur or the long bones attaches to it, which is right here, this indentation right here. I'm gonna remove the color so you can see it. See this kind of indentation right here where the bones are attached. So that will be called the acetabulum, where the bones of the legs are attached to the hips. Acetabulum. That's it. Do not worry about anything else. It says the obturator foramen. This is nothing else than this opening right here. Nobody asked about this. Remember, foramen is just an opening. So we have one opening on the base of the cranium, and we have an opening right here within these hip bones as well. But don't worry about knowing those names. You won't be asked. Just ask about the hip bones, particularly the ilium, which is the largest, most superior part. This looks like an ear when put together. You see? Looks like an ear. That is the ilium. But the hip bones, fair enough. The pelvic or hip bones. So remember that. What is another name for the pelvic bones? The hip bones. And vice versa. So not much to say about that, just hip bones. And the importance in medicine is because we use the hip bones as a landmark. See, this is a landmark. From here down, here's the waist. Here is the belly. So we use this as a landmark. When we're gonna give injections, we use this as a landmark to give injections in the buttocks, in the glutes. So for that reason, It is important. You don't have to give injections. So that's not our job as medical assistants. Let's talk about the lower limbs of the lower extremities. Very important because here there are a couple of questions that you will be asked in exams. The femur or the thigh bone is this bone. This is the longest bone of our body. Therefore, because the longest bone of our body usually is a very common question asked. Believe me. So they're going to give you a question that says, which of the following is considered the longest bone of our body? Look for the femur. The femur. If you don't see femur, you see the thigh bone, that is the same. But 99% of the times is femur. But you never know. I'm not the one who makes the test, but I'm giving you hints of what might be possible or a possible answer, if you will. So this is for sure one of those questions for exam. Next, the patella or kneecap. This is the little flat bone right here in between the femur and these two bones that are the tibia and the fibula, the lower bones of our legs. See, they're very similar to the upper limbs. We have the humerus up here, and we have the radius and the ulna. Here we have the tibia and the fibula and the femur, and then the toes. Very similar. Just some are superior, inferior, and of course, have different functions. So this is another question for exams. The patella. What is the name of that flat bone that lays right in between the femur and the lower bones of our legs? It is called the patella. What is another name for patella? Oh, kneecap. Remember, that's how they play around with these names. So you have to play around with patella, kneecap, patella. You don't need to pronounce it correctly. You just need to see those questions written on your exam and select those. That's basically what you have to do. So don't struggle. Oh my God, I need to. This is not a complete, like you have to enter information there. No, this is a multiple choice questions. This is not fill in blanks, if you will, test. No, it is a multiple choice. You just need to see what they've been asked and then to respond because the answer is going to be there. The longest bone of our body, the femur, the round, flat, bony structure in between the femur or that connects or makes up the kneecap, how it's called, patella, or the kneecap. So these are the things that you need to understand. Because these are structures are kind of unique and they have a very, very important function. Because these bones, the femur, are the ones that are connected to the hips, to the hip bones. Then we have the tibia and the fibula, just as we talk about the ulna and the radius. So the tibia is connected to the big toe. So this will be the tibia. And the tibia is thicker than the fibula. Another thing, another question right here for the tibia. The tibia is also known as the shin bone. The shin bone. The shin bone is which bone? Oh, the tibia. You need to know the ins and outs of these questions. If you know that the tibia is known as the shin bone, you should definitely know that the shin bone is also known as the tibia. You can know one way and the other one you forgot. Oh, I can take my train from my home to my workplace, but then I forget how to come back. That's not possible, is it? So if I take, for me, I take the E train to Manhattan School. I take the 7 train to Flushing School. I take my car to Long Island School. So how can I forget how to get there? How can I forget how to return back to my place? No, if I know how to get there, I should definitely know how to return, how to get back. This is the way that these questions are stated. They ask you one thing and then they ask you the other way around. And sometimes they repeat the same question and another question, just to see whether you were guessing or you actually knew the answer. That's the tibia. Remember, the tibia, also known as the shin bone. How do I know it's the tibia? Because it aligns with the big toe. That's it. Now, the fibula. The fibula, well, we know that these are long bones, so we not worry about this. So this aligns by the small toe, just like the pinky and the thumb. These are the only way that you can get this right. Because you don't know what is the tibia, what you know is the fibula if you're not paying attention to what it is attached to it. Because it can be confusing. And on an exam, I mean, if you have to check your shin bone, it's right in front of your lower leg. That's the main bone right there. That's the one that sometimes you hit the table or the night table or whatever else, and it hurts a lot. Make you see stars, even though if you haven't been in Hollywood. That's a bad joke, right? That's fine. The person who always laughs at my jokes is not here, I guess. Anyways, moving on. So that's how you're gonna remember those things. Location, what is attached to it? What is aligning with that I'm going to remember this? Remember, that's the only way that I can recall all these. Because I know it is attached to this, but of course, in my situation, I'm talking about when I was learning this. Now I know it simply automatically comes out. I just following a sequence right here on those PowerPoint presentations. So otherwise I will be all over the place, right? This is just for me, kind of guide me. But for you, you're just learning it. So you need to find a pattern of learning, a technique that can help you to remember certain things, not to remember everything. Remember, that's not the purpose of the classes. It will be impossible. Nobody, doesn't exist a person who remembers every single detail about a chapter that we cover. Not to mention, remember everything about every single chapter that you cover in every single class. It's impossible. Even though if I have nothing else to do in my life, I wouldn't be able to recall everything. It's impossible. But if you find you use a technique like mnemonics or you use cues, you're probably going to be able. And that's what I do. Because the only thing that I care about is that I can pass my test. The basic part. If 70 is the passing, that's all I wanted to accomplish. I'm not the type of person that have to get 100. No. Why should I struggle too much? Oh, I need to get 100. I need to. Well, yeah, that would be nice. But what gave me my certification is just the passing grade. Everything else, I'm going to demonstrate it when I start working. Oh, now you have to show who you are. That's how it works. Well, that's me. Let's talk about the tarsals. The tarsals are the ankle bones. Remember the wrist, here we have ankles. So the ankle bones are the tarsals. Remember the wrist bones are called the carpals. Metatarsals, the sole of the foot, the palm of your hands, it is metacarpals. See, do not mix them up. Tarsals, metatarsals, and phalanges, which are the toes. So usually because phalanges for the toes and phalanges for the fingers, we use the same terms. Then we ask about what is the name of the toe bones? Oh, the phalanges. What are the name of the finger toes? Oh, the finger bones. Oh, the phalanges. So just know that and you will be fine. Remember, most of this information, if you don't use it, you're just gonna put it on the back of your brain. You're gonna store it somewhere. And if you come across these things, you might have to retrieve it. You might have to go and review it. But it's not that you're gonna need all this. But it's good to have a general knowledge that at least you know that if something is not clear for you, says, by the way, I went through this. I don't recall it. Let me look for it. At least you know how to look for it. Let's see some clinical applications. Fractures. These fractures are fairly common on exams. And I'll tell you which ones, and the ones that I have here are the most common ones. So the fractures are classified according to the cause of the nature of the break. What happened to it? How did you get it? How did you fracture this bone? So what was the mechanism? How did it happen? So just to see the shape of the fracture, we know already what might have happened. Let's talk about the simple one first. Simple fractures. That was the name back in the days. We call it simple fracture because it was kind of not complicated, if you will. But it was not the real thing. It was not true because a fracture is a fracture. And a fracture of the bone, it is complicated. It's just that there are certain other fractures that are more complicated than this one. Now we call it closed fracture. Closed fracture. Remember, fracture, it is written as FX. This is an abbreviation. Fracture FX. So now we call it closed fracture. Why do we call it closed fracture? Because it is internally only. The bone breaks inside, but it doesn't damage the skin, the muscles. The bone does not protrude through the muscles or the skin. That's what it's called close. Pay attention, because we have now simple and we have compound. Now, what is a compound fracture? It is a fracture that is more complex, has present more risks, if you will. So now it's not called compound anymore. It's not called simple anymore. It is called open fracture. Close and open. A lot easier to remember this. What is a closed fracture? Oh, it is a fracture in which the skin remains intact. See, the skin is not damaged. What is an open fracture? The opposite. The muscles, the skin is damaged. The bone comes out of the muscles and skin. That's open. Now, if it is open, you're damaging the skin, the muscles. If you damage the muscles, you damage nerves, blood vessels, tissue, certain structures of the skin, not to mention all the microorganisms that you are exposing yourself to, because now you have an open space on the outside. So that's what it's called, open fracture. We have close and open. How do you know that it's close? Because it doesn't damage the skin. The skin is intact. Open fracture, the skin is not intact. The bone actually sticks out. This is another type of fracture. This is called a comminuted fracture. So if you have a question when they ask you what is a comminuted fracture, think about a fracture where the bone breaks in shuttles. The bone breaks in a lot of the little pieces. That's comminuted. Now, one of the most common questions is this one, green stick fracture. Green stick fracture is a fracture of children, because actually the bone doesn't fracture, the fracture bends, because the children's bones, they have more cartilage than bone, and cartilage do not break, cartilage bends. So that's basically what it is. If the bone breaks where it is ossified, meaning where the part of the bone it is now solid, it might break, but if it breaks only in one side. It doesn't go through it. Doesn't go through the bone. So let's see some images right here on this, and then you're gonna understand a lot better. So here it is a compound or open fracture. Look at here. The skin, the bone went through the skin. It is broken skin. Don't worry about what bone was broken. That's irrelevant. It can be any bone, but if it sticks, if it breaks the skin, it's called open. Here is the other way around. I'm sorry, this is an X-ray. When we see that this bone is sticking out the skin, it is a broken skin. Now, if the bone does not break the skin, then it's closed. Simple as that. Close inside the skin. Open, the bone comes out the skin. Simple. So if we use the terms literally, that's what it means. Open It breaks the skin. The skin is not intact, close. The bone breaks inside, but stays close. Does not leave the skin. Inside. Here are the other ones. So this is green stick. As you can see, it breaks in one end, but the other part is fine, but it bends. And the most important thing about green stick is it happens to children. So that will be the key for you to understand. This is the type of fracture that occurs to children. Oh my goodness, this is green stick. That's it. This is a fracture in which the bone breaks in several parts. That's comminuted fracture. You see? Comminuted. We're not asking about open, close. No, it breaks in several parts. The bone shatters. Comminuted. That is it. Green stick, comminuted, open and close. Everything else, do not worry about it. There are many. There are like maybe over 50 types of fractures. We're not going to talk about all of them. We're going to talk about the ones that are the most common fractures that comes on exams. Green stick, fractures that affect children, because that is the key. You have a 5, 6, 10 years, 15 years old child with a fracture. What type of fracture is it? Well, it's a minor. It is a child. So read the question, because sometimes it doesn't say, oh, it is a child, but it tells you that it's 5, 6, 7, 8, 9, 10, 11, 14. It's less than 18. So that's called green stick. If the bone has shattered of breaking several parts, that's comminuted. It doesn't matter who is having the fracture. If the bone doesn't stick outside the skin, it doesn't break the skin, it is closed. And if it breaks it, it's open. Simple. Any questions about fractures? So that's how you're going to remember this fracture. Remember, you use keywords. Children, the bone is broken in different parts, several parts. It is shattered, meaning boom, when little pieces. The bone doesn't break the skin, the bone goes through the skin, and it doesn't. Simple. Any questions? Okay, so let's move to the next chapter. The muscular system. So for the muscular system, we are going to start again. I'm going to move chapters. Here is the muscular system. So the muscular system, as the word implies, we're going to talk about muscles. Skeletal system, we talk about bones. Muscular system, we're going to talk about muscles. For the muscles, we are not having many questions. We're going to go over some of the few ones that are used for injections, administration, even though if you don't have to give injections, maybe for vaccines, but they are questions that commonly, are asked during examination. But it's a good idea that you understand what is the function of the muscles in our body. How many muscles do we have in our body? Do we have to go all of? No. What is the function of them? Particularly the ones that we have in the face. in our legs, in our arms, because clinically, we're going to apply them for clinical applications. Remember, injections, vaccines. Okay, so we have over 600 muscles in our body. Talking about 600, that is a lot. That is a lot. Remember how many bones do we have? 206. This kind of triples in comparison. Are we going to cover 600 muscles? Not even. We're just going to go over some important ones, and that is it. But we need to know what is the function of these muscles. Movement or mobility. Mobility, motility, movement means the same. You can use these terms interchangeably. But when we talk about movement, it's a lot easier because this is the word that we are used to use in our conversations. Mobility, motility, well, not so much. But in medicine, we use it. So for movement, because these muscles are going to be attached to the bones, remember. Alongside with the bones, now we can have the shape and now we can move. We can coordinate, we can balance the movement. Also, the muscles provides us with heat. These muscles are the ones that keeps our temperature of our body, keeps the internal organs from reaching a higher temperature because the muscles, they hold this temperature along with the skin. That's why we have all these structures before we get to the internal organs. So can you imagine it's very hot outside and all this heat from the environment enters our internal organs. We will die immediately because these organs are made of internal muscles these internal organs are made of very soft tissue. The skin is very tough. The muscles are very tough. So they kind of act as a barriers to the internal organs. So they protect the internal organs as much as the bones do. So they collect this energy and they keep it. That's why when it's very cold, alongside with the skin, it creates a barrier for the heat not to leave the body, stay inside with the internal organs. So the internal organs do not collapse. And if it is too hot, we start kind of sweating, sweat start coming out. That's just to humidify the outside of our skin so it can keep us cool. So internal organs are not going to be damaged. That's the purpose of all these functions. And that is how all these structures of our systems work. We don't have the skin right there just to look good, just to give us some type of frame to the body. No, they have lots of functions. They avoid friction. See? Can you imagine the organs having direct contact with the bones? It's going to damage it. So we have these cushions, if you will, which are the muscles that are covering the bones. So the soft tissue organs, when they kind of collide, hit the sides of the other structures, They do not bruise. They do not damage. Remember, we do a lot of stuff. We play sports. We get into fights. We fall. We do a lot of stuff. And what do you think all these organs that are hanging in the inside? They're going to be moving. Yes, they are held by some structures, but still, they are small. And we have to have certain structures that are protecting them inside. So that's basically what it is. As we increase our activity, so our body heat increases. You know that. I know that. If you're sitting like I'm sitting right here, actually I'm kind of cold because it's cold outside. But if I'm walking, if I'm running, if I'm practicing some sports, my muscles are going to be active. So my muscles are going to be letting out all this energy that they store right there, that they are accumulating because I need it. And then probably I'm going to start sweating to cool my body down. So that's what it means here, increase with increased activity. As much, as I become more active, more energy is going, more heat is going to be released from the muscles. So that's basically what it is. So just for you to have a general idea of what the muscles do. Just in case, having seen questions lately that my students tell me, oh, professor, they asked me how many muscles. I said, I hope you got the right answer because I told you that 600 muscles are the amount of muscles that you have in your body. But I haven't heard about this, so probably not. Let's talk about the type of muscles. Remember, we have types of bones: longs, short, flats, irregular. Well, here we're going to have different types of muscles. We're going to have skeletal muscle, cardiac muscle, smooth or visceral muscles. As the word implies, skeletal muscle means the bones are the muscles that are attached to the bones, to the skeleton. Makes sense? Cardiac muscle, oh, muscles that makes up the heart, because cardiac muscle only is found within the heart, not anywhere else. Smooth muscle, visceral, internal organs. So these are the muscle that makes up the internal organs. Remember that I already mentioned that the internal organs are made of smooth muscle, and internal organs means visceral. So they have soft tissue. So they have to be protected. And the muscles and the bones protect them because they are soft. They can be injured with just a little friction that they have against other organs. Think about people who play these very strenuous sports. Their organs, their muscles, the soft tissue get damaged. Boxers, they develop brain injuries, joint injuries, muscle injuries for life. Some of them, they actually die during the process. It's because of that. Because they go beyond what the body can actually cope with. So let's start with the skeletal. How do we know how is the skeletal, where it's located? Even though if I already mentioned the cardia, how do we know this is the skeletal muscle when we look in a piece of muscle under the microscope? We're looking at a piece of the heart muscle under the microscope. How do we know that this is the heart muscle? How do the forensic doctors, pathologists, knows where this piece is from this particular part of the body that was found? We have remains of a body. How do we know where is this part comes from? Where is this bone comes from? Because we're going to have certain characteristics about these muscles, these bones. They are very familiar because remember, all these tissues, all these systems are made of different cells, different characteristics, different shapes, different functions. So that's how we get to know all this. So let's talk about the skeletal muscle. Points to remember. Remember, skeletal muscle attached to the bones. That makes sense, skeletal. One of the things that you need to understand is it is called striated muscle, has some striations. I'm going to see an image later on. So if we will look at a piece of tissue under the microscope, we're going to check these striations, which look like crosswise stripes. So then immediately we know this is the skeletal muscle. Wait a minute, there are more, because some of these types of muscles, they can share some of the characteristics. So we gotta go for other things. This skeletal muscle is called involuntary because it's not controlled by the brain directly. We can give a command. Involuntary means it doesn't act by itself. We have to give it the command. For instance, you can say, okay, make a fist. You don't make a fist just because it is something automatically that happens. No, I'm gonna make a fist. Drawing blood from a patient, and I'm gonna ask my patient, can you please make a fist? I can make a fist. I can command my muscles to do that. Bend down on your knees. Jump. Try to reach out. I can command this. That's voluntary. So that's basically what it is. Contractions are voluntary. They are striated. They are voluntary. Think about this. These are the only muscles that are voluntary, the skeleton. So let's say that you have a question and they tell you, okay, these muscles are voluntary muscles. Immediately, skeletal muscle. Nothing else is voluntary. Nothing, no other muscles except for the skeletal muscles is considered voluntary. So right there, you have the answer. This is known as a voluntary muscle. We do not use the striations because the next type of muscle is going to be striated as well. So can use it, but we're going to use voluntary. Now, besides being voluntary muscle, what else did this muscle have? It's striated, has striations. That's a different issue. But voluntary has to be the key. This muscle is considered striated. Give me more, because I have two muscles that are striated. And it's also voluntary skeletal muscle. So these are the characteristics that we're gonna look for a muscle. Don't worry if it is microscopic or not, they're not gonna ask you that, but they're gonna say this. The characteristics of this muscle is striated and voluntary. Which type of muscle are we talking about? Skeletal muscle. The skeletal muscle is also known as a voluntary muscle. That's it. It's the only voluntary muscle in our body. So right there, you have an answer. Easy. Next, cardiac muscle. Once again, cardiac means pertaining to the heart. So this is the muscle. Just don't worry about what part of the size of the heart or the walls. It just makes the heart, cardiac heart. That's it. It is also striated. See, the voluntary, the skeletal muscle, it is striated. But what is the difference? This is involuntary. So we don't think about the heart contracting. You don't tell the heart, hey, stop contracting. Hey, wait a minute. You just stop pumping blood. Continue pumping. What are you waiting for? We don't tell the heart to do that, do we? Otherwise, then when someone has a heart attack, easily, hey, don't be lazy. Start pumping my blood again. No, we don't control it. The nervous system controls it. And that is automatic. So we don't have control of it. But we do have control over the skeletal muscle. You can do all these exercises, twist, turn, rotate, do so many things with your arms, legs, neck, whatever. Think about these sports people that do all this stuff, all these movements, all these contortions. But the heart is a different issue. There is something else within the cardiac muscle. It has intercalated discs. So it's not only have these bands within the muscle, but it has some intercalated discs that look like zigzag. So right there, I see that this is the cardiac muscle. But remember, if you see intercalated disc, you know already that is the cardiac. This is exclusively for the cardiac muscle. Involuntary is not exclusively. Striations is not exclusive because the skeleton has striations. The intercalated discs are unique for the cardiac muscle. So whenever you see a question when they said, okay, this type of muscle have or contains intercalated discs, that's the cardiac muscle, there's no question about it. This type of muscle is involuntary. Well, give me more. Why? Because the next tissue is going to be involuntary as well. Just like we talk about the striations for the skeletal and the cardiac, just give me striations, doesn't tell me anything. Unless the answer has skeletal and cardiac. Oh yeah, these have striations because you're naming two of the types of muscle that contains striations. That's a different issue, right? But in most of the cases, it doesn't happen that way. So the key for the skeletal muscle are voluntary. Remember, it's the only muscle in our body that is involuntary. Skeletal. The cardiac muscle makes the walls of the heart muscle. It contains intercalated discs, but also have striations, and it is involuntary, which is two differences from the skeletal. Intercalated discs, the skeletal doesn't have it. Involuntary, the skeletal is voluntary. But remember, voluntary striations are part of the other types of muscles. So it shouldn't be considered as the only difference between them, or to identify the type of muscle that you've been asked. Move to the next one. Smooth or visceral. So this is non-striated. See? Non-striated means it doesn't have striations because this is a smooth visceral, very soft. But it is involuntary. See? Involuntary, smooth, and the cardiac, because they are internal organs. But the heart has to work so hard that it has to have striations and it has to have intercalated disc. So that's basically what it is. So no striations. So if this type of muscle doesn't have striations, immediately you know that this is the visceral or smooth muscle. That is it. This is an involuntary muscle. Well, the cardiac is involuntary. The smooth is involuntary or visceral. You have to give me more information for me to pick either or. Very, very important. Just to know, that's what I highlight, or I gave it a different color to these structures. So when you see it, you say, oh, wait a minute, look at this. Cardiac muscle, striations, intercalated discs, involuntary. Skeletal, striated, voluntary. Oh, wait a minute, voluntary is the only thing common about skeletal. Oh, let's move for voluntary only. This intercalated is the only thing common about cardiac, nothing else. It is unique, I'm sorry, not common for the cardiac. So let's go for this intercalated disc. So those are the type of questions that you're gonna get. This type of muscle contains intercalated disc. Immediately, you should be thinking about cardiac muscle. That should be your answer. This type of muscle doesn't have intercalated disc or doesn't have striations. No striation, non-striated muscle, smooth or visceral. That is it. Okay, so let's take a break. And when we come back, kind of move on with this chapter and see how far we can go. Okay. All right, so we come back at 7:26. All right, this is 7:01. All right, take care. Enjoy your break. 7:26, we're gonna be back to continue with this chapter. Okay. Okay, welcome back. So we're going to continue with this chapter where we left off. I hope you guys enjoy your break. Okay, moving on. Here we have some of these muscles. We have the images of the type of muscles or the drawings, whatever you want to call. So we're going to go over this just to make sure that you understand what striations are, what intercalated these are. And of course, we're not going to see the whether it's voluntary or involuntary, of course not. So that's basically what we're going to do. Okay, so what is it? This is not working. Oh, now it is. It wasn't working before. Somehow I need to click right here. Okay, so let's pick a different color. Right here. So we have skeletal muscle. Now, if you see right here, we have the striations. Striations are these bands. All these bands that you see, these are striations. So that makes these muscles very strong because we have to do lots of work. We do exercises, we lift stuff. So all these bands, all these striations, these are what characterize skeletal muscle. Now, if we're going to see the cardiac muscle, let's change the color right here. We're going to see the bands, the striations. It has striations, it has striations, it has striations, but it also have this intercalated disc. So let's change colors, and we're going to use, let me see which color will be appropriate right here. Let's do this dark blue. Now, if we look right here in this area, we see some kind of lines that goes like a zigzag. These are the intercalated disc. So we can only see those within the cardiac muscle. Here we have another. And here we have more. So when we look at these structures through the microscope, we're going to see this intercalated disc. So we know already that this has to be heart muscle. Because we have striations as well. So this striation right here, well, it is common for both the skeletal and the cardiac muscle. So that should not be a definite, a determinant for you to get an answer. So here, skeletal, voluntary, plus, of course, the intercalated disc, but that's not a deal breaker, if you will. So voluntary will be the key because it's the only muscle that is voluntary. This one is involuntary. And this one smooth is involuntary. So therefore, we have two involuntaries, only one voluntary. So the only one voluntary is the skeletal. That will be the key. Here, the intercalated discs are the ones that makes the difference. The cardiac muscle, it is involuntary, but it has intercalated disc. No other muscles have intercalated disc. Here is the smooth. If you look at the smooth, has no striations, does not have intercalated disc. Therefore, it's completely smooth. It's very soft. It breaks very easily. It can get injured very easily because these muscles don't do much hard work, if you will. And they have this flexibility because they are supposed to be kind of having some type of movements when they do their functions, or they filter something, or they move to allow something to pass through. So they have to be very flexible, very soft. So that's the key. No striations, intercalated disc, a voluntary muscle. Everything else is common. Now, for you, it's just to know these characteristics. You're not going to have images, pictures, or anything about this. No, it's just for you to know definitions. And I gave it to you so you can kind of grasp these definitions and, start making your mind about, what is the difference between them. That's the best way that you can actually understand these types of muscles. Because when you're going to be asked, you need to know what is the difference between them, what differs them from each other. So then you said, oh, wait a minute. I know there's one thing that is different or differs one muscle from the other. Let's talk about these parts of, let's talk about the parts of the skeletal muscle. Remember, we talk about its functions, the types of muscles, how we are going to differentiate between these three types of muscles. Now we're going to talk about the parts. So each muscle has an origin and it has an insertion. Well, let's talk about origin. Let's talk about insertion. Before that, let's move to an image so we can talk about origin. And so this is the origin of this muscle. Is the point of attachment. See, this muscle attaches right here to this structure, but this part of the structure doesn't move, it's fixed. That's the key. The origin of the point of attachment is fixed. Now, the insertion, here is the origin. Here is where the muscle attaches, where it originates from. Here is the insertion. It is with attached, but it attached to a different bone. See? Different bone. So if this muscle were attached to this bone, it wouldn't do anything. It's just a muscle. Doesn't produce no movement. So you see, this muscle attaches to this original bone, but then the insertion will be another structure that is attaching to. And that's what makes the movement to happen. Because this muscle stretches and contracts, meaning it becomes long and then it becomes short, depending on the type of movement that you're doing. So this muscle acts as a rubber band. Let's put it that way. So if I want to kind of lift or bend my elbow, my arm, my hand, I want to get it close, very close, very close, very close to my shoulders. This is the part of the muscle that is moving. See? This is the part of the muscle that's moving, or it is becoming short or stretches. As I'm going up, 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 and up, this muscle stretches, 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 because I'm trying to lift this, get it close to the shoulders. So depends on the angle, see, that is forming to reach this area, then it's stretching, stretching, stretching. Then you put it back to the normal. When you stretch, you put your arm down. So that is the origin. The origin is the part of the muscle that attaches to one area that doesn't move. It is fixed. What about the insertion? The opposite. It is attached to the part of the bone or the structure that moves. So that's what you have to understand. It's not just, and this happens within articulations. You cannot have an origin and an insertion on a bone or a structure that doesn't move. You have to have an articulation in between, like here, like the elbow. So as I'm stretching this muscle stretches, it becomes longer. That's the stretch. Then you're getting closest to the shoulder. Then it stretches, it contracts, I'm sorry, it becomes shorter. So we have our hands all the way down. Then we start going up, 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 up. Well, the angle in between these is reducing, but this muscle is stretching. Why? Because I have to make it smaller and then you put it back. So here is contracting. As you getting closer and closer, the shorter. But if I get it back again, this is going to stretch. So that is exactly what it's trying to tell you right here. So every single muscle within a articulation has these two parts, an origin and once again, an insertion. If you read here, attachment to the bone that remains relatively stationary, fixed, when movement of the joint occurs. So this part of the muscle on the top, on the shoulders, that muscle doesn't move, it's fixed right there. The part that moves is the insertion because it's attaching to another bone, bypassing the articulation. So that's basically what it is. Now the insertion is the point of attachment to the bone that moves. So it's the other end, but to another bone that doesn't belong to that structure. There are two structures. Once again, this is the muscle of the upper arm. And here we have a muscle from the lower arm. Here are bones from the lower arm, and this is the upper arm. This is the humerus. Here we have the radius and the ulna. So it is attached to the radius. So when I bend my arm, this muscle, whether it becomes smaller or longer, stretches or contracts. That's the movement. That's what we have these particular names for the point of attachment for the part of the muscle that doesn't move and the point of attachment of the muscle that moves. Now, if you notice right here, you can see that these muscles are attached to tendons. Tendons. It's not that the muscle attaches directly to the bone. No, it doesn't happen that way. Within the joints, the muscles do not attach because then they will have no movement. Think about the thigh muscles that are attached to the femur. They are not moving. They are attached to the femur alone. But then we have a muscle or tendons that attach the leg to the lower leg, the upper leg to the lower leg, like this one. This muscle is called the biceps because it's on the front of the upper arm. So the biceps stretches and elongates as the angle goes longer, open. But as the angle reduces, then the muscle becomes smaller. That's what it's talking about. So one more thing, remember, tendons are attaches muscle to bones. Tendons attaches muscle to bones. We have other structures that are called ligaments. So let's think about let's go over and kind of discuss the differences. Remember, the good thing about anatomy and physiology is that if we talk about one, we have definition for one structure, the other definition is going to be the opposite to it. So let's read this. Tendons. See? Tendons attach muscle to bone. That's it. You don't have to read anything else because these are common questions for exam. They're going to ask you, which are the connective tissue that attaches muscle to bones called? Tendons. What is the function of the tendons? Attach muscle to bone. So you have to know in and out the definition of these terms. Because if you don't know it, then you didn't learn it correctly. Then we're going to have ligaments. What is the difference between ligaments and tendons? Because ligaments attaches bone to bone. So we have a bone right here, this bone and this bone, they have ligaments. Muscle attaches to bone through tendons. So you need to know these definitions because these terms are commonly asked questions during exam. So you need to know tendons and ligaments. Make sure that you learn one and the other one, it will be a lot easier because you know that is the opposite. Just learn one. I remember tendons all the time. I said, okay, tendons are the one attached muscle to bones. So if they give me ligaments, I know whatever is left, that will be bone to bone. Or if you think that is easier to learn about ligaments, learn ligaments. Don't try to learn both at the same time or try to memorize them because you're going to mix them up. I can reassure you that. You are going to mix them up. Why? Because this terms tends to mess you up. There is another structure right here that is called the bursa. Bursa. These are membranes. This is a sac. This is located in between the articulation, in between the joint, or this part that makes the joint. Because this is like the cushioning. This is like a little pillow in between the bones. Remember, the bones at the edge of the bone, by the heads, by the epiphysis, is going to have cartilage. Then the other bone has cartilage at the end. But then it has to have a membrane in between. And that membrane contains some fluid, which is called the synovial fluid. So they are in between the joints. So here we have the bursa. So here is the articulation. Let's put it this way. Here is the other one, the articulation, and the other ones. So right here, there is a sac. There's a little membrane. Think about that. This is a membrane that contains some fluid. So this bone and this bone do not kind of collide, do not create friction between the bones. It will be very painful. Remember, that's arthritis. So we have this cushioning right here, this fluid, this membrane, this cartilage that doesn't allow this bone on the upper part of the arm to friction with the one below or this one because it's separated. That is the bursa, the membrane. And you have a condition that is called bursitis, which means inflammation of the bursa. Well, it is a problem, maybe due to trauma to the elbow. Let's say people who does lots of things using kind of bending and stretching the arms all the time. Like tennis players, people who works in construction, people who works in farms are continuously bending and stretching the elbows, doing some type of work. So this is going to be worn off. It damages. So then you can have first some inflammation of this membrane. And then when they kind of swell up, they produce increased amount of fluid right here. So you see a bulging right here on the elbow, and it's very painful. So that limits you from doing your work. That can happen within the knees, shoulders, because we have all these structures right here. We have bursa within the joints. It's in between the joints. So once again, take home point here is tendons and ligaments for this particular slide. Know what the tendons do, what is the function, and what the ligaments functions are. Learn whichever you think that is easier for you to remember. Ligaments attaches bone to bone, tendons attaches muscle to bones. It's not the same. Ligaments are not the same as tendons, so be careful. Let's talk about the type of movement that these articulations alongside with these muscles have. So muscles usually have three different types of movements, or three groups of movements. Some of the muscles will be considered the prime mover. Some others will be synergist. Some others will be antagonist. Well, let me explain you this. What is a prime mover? A prime mover is the muscle in charge to do most of the stretching of the articulation or the contracting of the articulation. So that's basically what it is. It's the muscle that does most of the work on that particular movement. So let's talk about here this image. When I'm contracting this muscle right here, which is called the biceps, this is the biceps. This will be the one that does all the work. It's this big muscle, the one that helps to raise or get your hand closest to the shoulder. Then which muscle will do the opposite? That will be the antagonist, the triceps. This muscle that is on the back of our arm is the one that brings this arm back to the normal position. So y stretches. So this is called antagonist. So this is agonist or prime mover. This is the antagonist. Anything that goes against something is antagonist. See, pro-abortion, the ones that are in favor of abortion, in favor of abortion. Anti-abortion, the ones that are against. So agonists and antagonists. But here we call it prime mover because it's the one that's making all the work. See, this is the muscle that makes all the work when I'm trying to bend my arm by the elbow. Then if I'm returning back my arm, then this is stretching, this is contracting. So the one that contracts is called the prime mover. The one that stretches is called the antagonist. So that's what we have here. Luckily, you don't need to know these terms for exam purposes because usually they don't ask. But it's a good thing that you know that we have some muscles that do all the work, some others do the opposite work, and vice versa. So this is like a cycle. I'm bending my arm by the elbow. This muscle is contracting the biceps. So if it contracts, it's becoming shorter. So this is the prime mover. The one on the back is stretching because as I bend my arm, this stretches. This stretches right here. It becomes longer to allow the arm to go all the way up. When this is going down to the normal, this is becoming longer. This stretches to the normal size. So let's talk about this. Muscle whose contraction is mainly responsible for producing a given movement. In other words, is the muscle that does all the work to contract that muscle contracts to produce this particular movement. Now, antagonist, muscle whose actions opposes the action of the prime mover. So that's what I gave you the sample with the prior image. When the biceps is contracting, is kind of getting the arm close to the shoulder, the triceps is stretching, which is the antagonist, and vice versa. When the triceps is going back and becoming shorter, it contracts, this is stretching. So that's how it works. So in other words, the muscle that contracts is the prime mover. What is synergies? Synergies is when you have a bunch of muscles doing the same function alongside with the prime mover. Think about this. Just because I have here the triceps, the biceps, my bad, does not imply that there is only one muscle. There are other little muscles, other accessory muscles alongside with this. Well, if the major one moves, this one has to move. Let's say that this is a family. This is the father, the biceps, and the mother. Father, mother, and father. So these are, and they have children. So wherever the father and the mother moves, they're going to move alongside. They're not going to leave the children alone. So this is the same. There are other muscles, minor muscles, smaller muscles attached to this muscle. So whenever this moves, the other one moves along. Those are called synergies. We apply these in every single thing. So let's say that you're going to do work, but you cannot do it by yourself. We call it teamwork, right? That's synergies. Other people is getting together to accomplish one task. So teamwork is synergism. Let's say in medicine, besides muscles, you have the cold. Just put it that way. You have the cold, but what is the cold? You have cough, you have secretions coming out, probably. You have probably body ache. You probably develop fever, right? Well, there is no one medication for everything. So I'm going to synergize your treatment. I'm going to give you pain medication. And that pain medication might be also good for fever, but it's not good for cough. So I'm going to give you another medication for the cough, another medication to get this phlegm out. So that's how it works. It's a synergism. So when you have more than one muscle working together to complete certain movements, that's called synergism. That's it. When somebody comes to the rescue to help you out with something, that's synergism. You alone, you cannot do it. So you have other people helping you out. That's called synergism. So simple. I give you samples, real life samples, so you can put them together and you can understand this better. Because this is new for you. This is new terms, new definitions, new material for you completely. So I want to make sure that you kind of get this with no trouble. Okay, so we know that the prime mover is the one that does most of the work. Then you need assistants. See, we have that in our workplace. We have a director. We have teachers. We have the person who do the maintenance of the offices. So the director by itself is the prime mover because the owner, he's the one that opened the business, right? Everybody else is like an accessory to it. If the director tell you to do something, you have to do it. If the director closed business or the owner of business, everybody's without job. That's called synergism. Everybody goes or everybody comes. Antagonist, you're against. So the muscle that does the opposite of the prime mover is called antagonist. And when you have a bunch of muscles working together, that's called synergism. Okay. Because if I'm gonna just read whatever is written there, well, probably you're gonna be lost. I don't want that. I want you to actually understand what's going on with this terminology. Okay, let's move to muscles of the head and neck. Well, we're just gonna mention them. There are some particular characteristics of each muscle, and I'm gonna touch bases on those that probably will be part of your exam. So just for you to know, let's talk about the facial muscles once again. It says right here, facial muscles, orbicularis, oculi. Now, these are medical terms, but these come from Latin. Orbit, what is an orbit? Something that is a circle, see? Orbicularis. Oculi, oh, sounds like eyes. Oculi. So these are the muscle that makes up, the area where the eyes are located. These are the ones that helps your eyes to close, to blink. And you see, they are like rims right there. That's what is called orbicularis, like orbits. See, right here. So when we close our eyes, these muscles are the ones that is helping you out with that. When you blink, this is the muscles that help you with that. If you blink in too much, then these muscles are not working properly. If your eyes closes without you wanting to close, then it's because these muscles are not working properly. Then we have here ocularis, orbicularis oris, or remember it's mouth. Orbits, so these are the muscles surrounding the mouth, not the lips. These are muscles. So these are the ones that, once again, closes your lips, like when you kiss. See, when you send kisses or when you make this movement to close your lips and kind of flies and kisses, those are the orbicularis oris. So in other words, just know that there are some muscles that help us to close the mouth. And of course, we're gonna find some others that it's gonna make us to open the mouth. And the ones that help us to close our eyes or the eyelids. That's what it's called, orbicularis oculi and orbicularis oris. Remember, orbicularis means orbits, means circles. Now we have the zygomaticus elevatus. So the zygomaticus, remember we have the zygomatic bones. So then we're going to have the zygomatic muscle, which is this one right here. So the zygomatics, they help us to see, elevates the corner of your mouth. So whenever you glince, whenever you smile, this muscle pulls the corners of your mouth. They stretch the muscles. So we have different muscles that do different functions. Remember, this is not just one muscle that we have in our body, in our face or in our body. No, that's we have 600 of them. And if you see all these intertwined muscles, they have different names, and each one of them has a different function, depending on what structure it is attached to it. Muscles of mastication. Mastication means chewing. When you chew your food, you masticate them. We have the masseters, mastication, masseters. So they are the one in charge to elevate and to protract. So goes up, or they elevate it and they pull it back. Your mandible. So they help this part right here to move. So remember, the mandible, the lower jaw is, or the jawbone is the one that is the only movable bone in the facial bones. But it is attached to these muscles, and these muscles are the ones that allows this bone to go, move, to have certain movement. We have the temporalis. These are the one attached to the temporals. See, we have masseters and temporalis. So all these muscles right here helps to do certain movements in the face, in the mouth, in the mandible. So we're not going to talk about details, but just for you to know that there are a bunch of facial muscles. And each one of them has a different function. Fortunately for exams, they're not something that they're gonna ask because it is difficult to remember all these names. Then we have the sternocleidomastoid. Now the sternocleidomastoid is the longest muscle within the neck. Is this muscle right here? It's connected to the head and all the way to the sternum, right here. And what is the function? Help us to flex and rotate the head. Remember, the muscles by themselves, they don't do much. The bones by themselves, they don't do much. So they need each other in order for them to accomplish all these movements. Now, sterno means sternum, cleido means one of the muscles, and mastoid, that's another structure. So sternocleidomastoid, it goes from here, the mastoid, the cleido, to the sternum. So there are three structures that they are attached to it. So just in case you hear about sternocleidomastoid, this is the longest muscle of the neck. They're not going to ask you what is the function, but it's just what is the longest. That's basically what it is. And you see the name, sternocleidomastoid. Any other name is not as long as this one. The trapezius. Now, the trapezius, this is the one located within the shoulders. On the back, it looks like a triangle. It sets, elevates the shoulders and extends the head. So on the back, once again, is the trapezius. So just for you to know some of them, this is not a muscle that they're going to ask. Muscles are not usually common questions asked in exams, except for few of them that I will mention that we use for injection administration. Other than that, usually not. Not for this type of exam. Here are some of the muscles that I mentioned before, the biceps and the triceps. Remember, the biceps is the anterior, the triceps is the posterior muscle of the upper arm. That's basically what it is. Now, what is the function? They flex the forearm. See, the biceps flexes. Remember that we have the image. The arm is flexing. This is so it's flexing, going this way. Extend, it move it back again to the normal position. So when we're flexing the arm, the biceps have the primary mover. And the triceps are going to be the antagonists. When this goes back and flexes, this one becomes the opposite. So that's basically what it is. It's like you going to work and then coming back. Always the opposite. Now we're going to have the deltoid. The deltoid muscle is very important, not only because it abducts upper arm, meaning kind of help to elevate. Abducts means to elevate, meaning that I'm standing right here and I'm elevating my hand and separating my arm from my body. I'm putting it away. That's called abduction. Think about a child that is being abducted. What it is, it's taken away. So when I lift my arm in the same plane and going up, 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 away from my body, from my trunk, that's called abduction. So again, there are many things that can work with this. Now, what is important about the deltoid? The deltoid is this big muscle right here by the shoulder, by the top of the upper arm. So what is important about here? Because here is when we give most of the injections. We can give intramuscular injections, the vaccines we are giving it here. So that's what is important. So questions for the exam. What is the name of the muscle on the upper part of the shoulder or the arm? The deltoid. The deltoid. And this is one of those muscles that we use to administer medications. We can give intramuscular, subcutaneous, and the vaccines. These are injections. So that's what is important. So you need to know which is the muscle that is located on the upper part of the arm, the deltoid, because that's what they're going to ask you. Keep it in mind. See, I will make emphasis on those particular structures that are more commonly asked questions, because everything else, not so much. So that's basically what it is. Here, we have the iliopsoas, flexes the thigh. So are they going to ask about the iliopsoas? No. About their functions? No. So we just leave it there. The hamstring muscles. These are the one that flexes the lower leg. Oh, are they going to ask me this? No. This is a group of muscles. If you see here in this image, there is a group of muscles. They're not going to ask you about this. Oh, let's talk about the gluteus. Yes. The gluteus is a group of muscles as well. So we have the gluteus sternus, the gluteus maximus. So whenever you're going to give an injection, intramuscular injection, these are the muscles that you can use. Be careful. You're not going to be putting injections in any area around the center of the muscle or the lower part of the muscle. And either side, you don't do that, because right here we have the sciatic nerve running underneath. And if you pinch the nerve when you give an injection, you're going to paralyze this patient from the gluteus down. So not good, right? That's the reason why medical assistants are not allowed to give medications in the gluteus. You don't give medications at all. Not through injections. This is for the nurses to do it. So most of the time you use this upper part right here, because first of all, it doesn't have nerves, it doesn't have many blood vessels, and it doesn't have many bony parts, because you can actually hit a bone with the needle, because those needles that we use here are actually long. So remember, the gluteus is the part that we put the injections. So for that reason, the gluteus will be asked, but it's not the gluteus maximus. Maximus means larger part, which is all this puffy, nice part of the back of your gluteus. No, it has to be on the lateral side, on the upper part, almost close to the waist. But that will be the gluteus. Gluteus is the buttocks muscles. So once again, deltoid and the gluteus, but the gluteus, remember, lateralis, those are the ones that you can use for medication administration. We will go over this when we have to do a little of medication administration, needles, and some basic stuff for this part of the clinical procedures. Now, because you have to give it to the patient, not because you have to use these particular techniques, but because of exam questions. Remember, that's the whole purpose. So deltoid, the gluteus, but the gluteus lateralis. Next. Oh, what happened? Finish? Oh, we don't. Well, when we get to the other chapter, I will explain you something else about medications, injection administration sites. So that's it. So we're done with this chapter as well. So let's kind of go over the next chapter, just touch bases a little bit before I let you go because it's too early. If I let you go at this time, oh my goodness, they're gonna fire me and I will be without job. Who will pay for my food? Oh, no, that wouldn't be a good idea.
No, you can't have that.
No, not at
You
all.
your job.
Yeah, no, I'm not gonna lose my job at all. I mean, as much as I wanna let you guys go, oh my goodness. Nobody heard that. This is being recorded. This has been recorded. You know that, right? And then they're gonna say, oh, this professor, they're looking for a replacement right now, I guess.
We don't need a replacement.
Okay. Thank you. Let's move on to the next chapter, which is we did the muscular. This is the integumentary system. Now, this is very related to the muscles. It's just that we're not going to be talking about muscles. We're talking about the skin and those accessory structures. I like all these systems. I don't know. I'm a medical person, I guess. So let's do this. Let's put this so you can see it, because I already removed this from your screen. Okay, can you guys see it?
Yes.
This is the integumentary system. Probably you never heard about this term before.
He just set himself up for the Oscar.
Oh, turn your microphone off, please. Thank you. It's all right. Sometimes happens. We just don't want to hear anything else right there. Okay, so integumentary. Who heard about integumentary system if you have not taken these classes before? Well, we don't say these things. We only mention it when we talk about this particular system. So once again, integumentary is going to be the skin, and it is accessory organs, which are what is attached to the skin: nails, hair, sebaceous glands, or those glands that produce sebum, and the sudoriferous glands. So those glands that produce the sweat glands. So that's basically what we're going to be doing here. Let's talk about the functions of these structures, because that's very important. Skin and its tissues. So when we have two or more types of tissue grouped together, we're going to call it an organ. Why? Because the skin is an organ. And be careful, questions for exam. Which is the largest organ in our body by surface, by weight? The skin. See, the skin is an organ. Why? Because it's made of cells. A group of cells makes up a tissue. A group of tissues makes up an organ. And this is an organ because it has cells, tissues. So that's basically what it is. There is another question right here. What is another name for skin? Cutaneous. The cutaneous membrane. So they like to ask these questions, believe it or not. So skin is also known or also called the cutaneous membrane. So remember, skin is the longest or the largest organ in our body when it's related to the surface or the weight. Because the actually largest organ of our body is going to be the liver. But then it says based on weight, by weight. Oh, wait a minute, that is a different issue, the skin. So they're going to give you the skin, the heart, the liver, and you said, oh, the liver. Wrong, because you didn't read the entire question. It was based on weight. If they said, what is the internal organ, the largest internal organ? Now you know that the skin is not internal. The skin is external. So that's what I want you to understand. Every single time that you see a question, go over it, read it, read the complete question. There is one word within the question that is going to tell you the answer. 60% of the time, the question give you the answer. But then we see it, so obviously we notice it. It says, oh, no, that can be. They try to trick me. That's what I used to think. And then I learned the hard way. Because I didn't pick that one. I didn't select the one that I thought, but then I said they are tricking me. Then I got it wrong because I didn't select that. No, sometimes let your instincts go for that. I used to change my answers all the time because I wasn't sure. And a little something kind of distract me. And I was like, oh, no. I got to go there and change my answer because, oh, I got something wrong. No, I leave things the way they are. And then when I get the results, I congratulate myself. So that's how it works. So the skin, which is the largest organ of our body by weight, which is also known as the cutaneous membrane, it is not the only part of the integumentary system. The skin also have other accessory organs. Remember, hair, nails, sun glands, sensory receptors. Think about these. When somebody touches you, you feel it. Oh, yeah. Sensory receptors. If it is hot, if you burn yourself, or if it is too hot outside, you have, wow, temperature receptors. If it is cold, heat receptors, cold receptors. So we have a lot of stuff. So it's not just one thing. So that's what you have to kind of put all these together and then try to understand how this works. So here is the skin. So the skin has three parts, three layers, three walls. You can use it either of these terms. They can be played interchangeably. Layers, walls, hearts. So let's talk about the first one, the epidermis. Very simple. Epidermis is right here in this image. It's all these parts. This is the surface of the skin. The outer layer, see, just the outer layer of the skin. What is the outer layer of the skin? Oh, it is the epidermis. Epi means above, on top, surrounding. Dermis means skin. That's it. So the outer layer, the epidermis. The middle layer, the dermis. Epidermis, dermis, hypodermis. See? Just learning these medical terms are going to facilitate you remembering these terms. So we heard about the dermis. Probably we don't use much epidermis, hypodermis, usually not. So it says right here, dermis is the inner layer. Well, things have changed. Remember, everything changed. So back in the days, we use three parts, three layers of the skin. See, they are still here. 1, 2, and 3. So what is now they saying that it's only 2? Well, forget about this. This is just on other levels of medicine that you're going to be using this, but don't use this as the inner layer. Now, remember, for your exam, you're going to answer there are 3 layers of the skin. 3. Epidermis, dermis, and the subcutaneous. See, cutaneous. Sub means under. Under the dermis is the subcutaneous, or hypo. Under the dermis, hypodermis. This is the fat tissue. This is the fat layer. So remember, when they do this procedure that you guys heard a lot, liposuction, this is the layer that they remove. The fat layer, the hypodermis, or the subcutaneous. It's not the dermis, it's not the epidermis. They have to go underneath all these layers, the first 2 layers. This is the fat tissue. So that's basically what it is. Now we're going to talk about each one of these layers independently to tell you what is the function, what do you find within these layers. So what is it that they are so important about it, and functions. So that's something that we definitely need to take in consideration. So make sure that, you kind of try to understand this in a very basic way. 3 layers, 3 walls made up the skin. Epidermis, dermis, hypodermis of subcutaneous tissue. Now, question for your exam. Please don't forget this. This is also known as the fat tissue, the fat layer of the skin. That is the hypodermis of the subcutaneous. There is another name for this that means fat, adipose. Adipose tissue. It's written like this. Adipose means fat. So adipose, hypodermis, subcutaneous, the fat tissue, the fat layer, the fat wall, all means the same. Unfortunately, in medicine, some of the terms have different definitions or more than one definition, if you will. But adipose, fat, think about fat because it's very commonly a term used for exams. Now, if we were talking about the medical exam, for medical doctors, then we'll not ask about the fat tissue because we should know that this is called the adipose tissue, the subcutaneous, the hypodermis. But in your level, they try to use layman terms so you can remember this a lot easier. So think about that. 3 layers of the skin. So you're gonna have a question where they're gonna ask you how many layers the skin has. So look for 3, not 2, 3. What is the lower layer? What is the subcutaneous layer also known as? What is the hypodermis also known as? Adipose tissue is also known as fat tissue. Think about that. Let's talk about the epidermis. Just give you a little information, very basic. Is the outer layer of the skin. Remember, we know that epi means outside. It says that it lacks blood vessels. Oh, wait a minute. How they survive? No worries, because this epidermis has 5 little layers within. We're not gonna go over them because not really necessarily. 1, 2, 3, 4, 5. This makes the epidermis. So the bottom ones, they have blood vessels. So they kind of provide nutrients to certain layers. The outer layers are completely dead cells. See, this outer layer where the hair grows on the outside of our skin is a dead tissue. Contains dead cells. Oops. It is right here. It says contains dead cells. Oh, what do you mean dead cells, professor? Yeah, these cells that are on the outer surface of the skin, they are dead. Think about this. Sometimes when you woke up from sleep and you look at your skin in your hands and your arms, legs, probably, they look kind of different color and they kind of faded. And sometimes you kind of scratch your hands or move your hands or try to clean it with towel. Little flakes comes out. These are dead cells. That's how we remove the dead cells from our body. We push it to the surface and start removing. They look like a little scales. That's what some people have, like this very dry skin, not because they are kind of dehydrated all the time, but it's because they have lots of dead cells in there. So that's what we use certain creams to kind of moisturizers to kind of moisturize the skin. But sometimes it looks kind of very dry. And that's the reason why, because we have all these dead cells on the surface. It says right here, this layer of the skin is made of mostly of keratinocytes. Think about keratinocytes. Keratin. What is keratin? This is a substance that it makes our hair, our nails. And our nails are hard. If you cut your nails, it doesn't hurt. If you cut your hair, it doesn't hurt. Why? Because it's made of dead cells. That's basically what's keratin. Keratin is produced by our body, particularly in one of these layers of the epidermis. So we will see how that plays out. So for you, just make sure that you understand, oh, this is the dead tissue of the skin. What is it? Oh, the epidermis. That's it. This tissue contains keratin, epidermis, because it's dead. It's a very tiny layer. It protects the other layers of our body. So melanocytes. Pay attention to this because keratin is produced within the epidermis. But there is something else that is produced here within the epidermis, something that is called melanocytes. Melanocytes are cells that produce something that is called melanin. And what is melanin? Melanin is those pigmentations that gives the color to our skin. So let's say that they ask you, where is melanin produced? Epidermis, not the dermis, not the hypodermis, not the subcutaneous, not the adipose tissue, not the fat tissue, the epidermis. Keratin is produced with the epidermis, melanocytes, because the melanocytes are the ones who give us the color to our skin. The more melano means dark, cytes means cells. These are the dark or the black cells. So the more melanocytes that we have, the more dark our skin is gonna be. So what happened to the Caucasians? The Caucasians have very little melanocytes, meaning they produce very little melanin. What happened to the black people? Well, they have more melanocytes. We cannot use, oh, well, the Afro-American people. Well, I think that there is no need for that. This is not a racist statement. This is starting something. We're not talking, this is not a regular conversation with someone. Then if we use those terms, then that it would be kind of offensive. But this is medicine. We're talking about classes. So again, the more melanocytes producing melanin, this dark pigment, the one that gave us the color to the skin. So whenever you hear about keratin or keratinocytes, these are the cells that produces keratin. Melanocytes, these are the cells that produces melanin, the dark pigment. So you're gonna have a question when they're gonna ask you, which of the following cells produces melanin? Look for melanocytes. Or they're gonna ask you, because remember, you're gonna have different type of tests. They invert the question. Some of you are gonna have the same test, some others different tests. The questions are randomly selected. So some of you are gonna have, okay, which cells produces melanin? So you said, oh, melanocytes. What is the name of that dark pigment that gives the color to the skin called? Melanin. What is the dark color that is produced by melanocytes? Melanin. So you need to understand this in and out. Because if you don't, then you're going to have problems understanding the question. Remember, some of the questions are not going to be straightforward. Melanocytes produce melanin. Oh, easy. No, they're going to try to kind of word it, and they put little something in there, some distractor words to make you think, to see if you really understood what the question was all about. So that's basically what it is. So melanin is produced within the epidermis. What produces melanin? Not epidermis. Epidermis doesn't produce melanin. It's melanocytes. But the melanocytes are within the epidermis. And what melanin does, gives the color of the skin. So that's basically what it is. Remember, the more melanocytes, the more melanin is produced. The less melanocytes, less melanin is produced. So the people who are very light skin, they're gonna have less melanocytes because they produce the less melanin. If you have dark skin, then you have lots of melanocytes because they are producing a lot of melanin. Good. Any questions? Okay. Remember, don't be afraid. Don't just ask if you have anything to ask. Let's talk about the dermis. So the dermis usually called the true skin. So that's another question. If you have in your exam, which of the following layers of the skin is called the true skin? Dermis. Dermis. Now, remember the true ribs, right? The true ribs are the ones that are attached to the back of the spinal column and to the breastbone, the sternum. Well, here, well, they're not going to be attached to them, but these are the one that contains all these accessory organs. They're going to have the hair or the hair follicles, the sweat, and the sebaceous glands. They have the sensory receptors. They have nerves. They have blood vessels. So they have a lot of stuff. And right here they are. Look at this. All this is the dermis, all this area. And here we have the hair follicles. Here we have the sebaceous and the sudoriferous glands, the veins, the arteries. All of them are from here. Your nails comes from the dermis. The hair comes from the dermis. It's not just from the outside, from the epidermis. No, they are from the dermis. If something is not functioning within the dermis, then we start losing all these structures. They start dying. Think about you have a burn to second-degree burn, which is the dermis is involved. Well, you're gonna damage all these living structures within. So you're gonna cause a lot of damage to the person. So that's basically what we need to understand. Because this is medicine. And we learn about some structures because patients are going to come over with some conditions of the skin. So then we're going to understand, not us as a medical assistants, no, because you're not a doctor, you're not going to diagnose. But at least you know that something is going on with this particular part of the skin. You're going to understand what they're talking about. You're going to understand what the doctor is explaining the patient. And you have sometimes to translate, you have sometimes to reinforce this information to the patients. But if you don't have no idea what all these systems, structures of our body are, so then how are you going to accomplish this task? You will be able to. So once again, that is basically what the dermis is so important. Remember, it is called the true skin, because it contains all these accessory organs. It is not the inner layer. Don't, for your program, for your exam, don't use it as the inner. I can tell you that much. So forget about the inner. It's just that the new textbooks, they have all these changes. But for the exams, they have not changed. So for the exams, the patient, the human body still have 3 layers of the skin. epidermis, dermis, hypodermis, or subcutaneous or adipose or fat tissue, period. So remember that the skin or dermis has nerve cells, so nerves, blood vessels, because they are the one that provides all the nutrients through the blood is the media or transport that we have in our body. And the nerves, because they cause these muscles to contract. Otherwise, they will be paralyzed. So that's basically what it is. The hair follicles, which is the roots of the hair, they are generated right here within the dermis. What you see on the outside is the shaft of the hair. We have sweat glands, the glands that produces sweat, which are right here. We have sebaceous glands, which are the glands that produces sebum or the greasy part. That's why our skin sometimes looks very greasy, or the reason why we develop all these pimples or other things due to excess of the oil glands. So let's put it the oil glands. Sebaceous is oil glands. Once again, we have sensory receptors like pressure receptors. If I pinch your skin, if you kind of something falls on your foot and it presses your skin, you're gonna feel pressure. Tactile means touch. Somebody touches you, you feel it. We know when somebody touches us in good way or is trying to harm us. Because our body, the skin, are the one that has these receptors that is gonna tell us how do we feel. Touch, we have receptors of pain. Of course we do. Heat receptors, meaning temperature receptors. When it's cold, we feel it. When it's hot, we feel it. So that's what is called the true skin. Because remember, the outer layer is a dead tissue. The other one is just fat. So that's the reason why they want to move the lower part of the skin and not call it part of the skin at all, because it's just fat. Okay, any questions about the dermis? I'm gonna continue with this. The accessory organs or structures of our skin. Now, again, extends into the dermis or hypodermis. So yes, they go through all the layers from the inside to the outside. Blood vessels are within the adipose tissue, the subcutaneous tissue, the hypodermis tissue, to the dermis, to the outside. So that's basically what it is. But here we have, again, the accessory. Remember, accessory is something that is extra, that is added to it. This is like when we wear clothes, those are accessory things. When you wear a watch, rings, bracelets, necklaces, anything that you put, glasses, those are accessories. Can we live without those accessories? Yeah. But inside the skin, some of the structures are very important. But if you get a bowl, are you gonna die from that? No. If you don't have, body hair, are you gonna die from that? No. If your nails fell down, are you gonna die from that? No. See how these are accessory because they are part of the functioning of some things of our body. But if we remove them from our body, it's not that it's going to cause something really serious. You're just not going to look good without hair, particularly in your head, without nails. So we have, once again, these glands, sweat glands, and the sebaceous of oil glands. So once again, if the dermis remains intact during an injury or a burn, everything is going to be there. But if the dermis is involved within a trauma or a burn, then you're going to damage these structures. And if you damage the structures, the problem is not only damaging the structures, is the open door that you're creating for infection. Do you know that a patient who gets a second degree or mostly second degree, they die not because of the extent of the burn, but because of the infection, because this layer, which is the one that protects the outer part of our body, the one that protects us from any invaders coming inside our organs, now they are allowed because we don't have this defense mechanism, this barrier, which is the skin. So we die from infection, not just because of the burn. So that is what is important. See, those are the functions of the skin. Protection. It protects us as a barrier. So it doesn't allow external things to come inside our body. But if our skin is damaged, is injured, now we're going to have an open door for these microorganisms to come inside and to cause infection. So let's talk about these skin functions and we'll leave it for today. So we have lots of functions. Protective covering barrier. I already mentioned that. This is a barrier that protects internal organs. So anything that it is on the outside, if a mosquito bite us, it bites our skin. So if we're going to produce a condition, it's going to be skin condition. It might go somewhere else, but we can block it right there. Can you imagine without the skin, this mosquito will be directly injecting the infection to the heart, to the lungs, to the liver, to the kidneys, to the pancreas, to the small, large intestine, and so on and so forth. That wouldn't be a good idea, right? Because then this organ is going to become sick. No, we have this barrier on the outside. Prevent some water loss. Well, we have lots of fluids within the tissues. So if it wasn't because of the skin that has this protein, lipoprotein structure that doesn't allow water to go in or come out from our body. Just think about this. You're taking a shower. When you take a shower, water does not go inside our body and float us or float us, nothing like that. And if you're swimming in a pool, in a river, in, I don't know, in the ocean, your water is not going to go inside unless you don't open your big mouth. Now, if you open your big mouth, well, lots of water is going to go in, but that's not through the skin. So that's a different issue. Water is not going inside our body from the outside because we have this barrier right there, the skin, and the liquids that we have inside, they don't go outside unless it is a way of protecting us from heat. For instance, it's very hot. I'm sweating, or I'm walking, I'm doing exercise. Of course, my body is removing something through the skin. But that is something that has to happen. Otherwise, liquids do not continually start seeping out our skin. So that's basically what it is. We know already that contains these sensory receptors, all these receptors of touch, pressure, pain, temperature. Our skin also secretes some wastes. Oh, wait a minute. What wastes are we secreting? Oh, this sweat. See, underneath our axillary line, our axilla, armpits, the groin, and on the sole of our foot. You see, we have some secretions. That's why it smells bad sometimes if we don't take a shower or we